Today we're going to talk about discharge, and we're not going to look at men because we only have two types in men, and it definitely very straightforward. But for ladies, we have a thin line between normal and abnormal, and I'm here to make sure that by the end of this video, you know the difference between them, so that in case you spot any kind of a discharge, you can tell whether it's normal, it's just a normal body process, or there's something underlying that you really need to take care of. For men, let's get first of all be done with men. You have two types. You have normal and abnormal. Normal is when you are sexually aroused. That tiny, small amount of fluid that usually come out, that discharge is normal. And the function of that is to prepare the urethra, because you share the urethra both for passing urine and also for passing the semen. That discharge that usually happen when you're sexually aroused is just to prepare the urethra for the passage of the semen that contain very delicate sperms. So that's normal. Any other type, if you're not sexually aroused and you have a discharge, you definitely need to see a doctor because you have an infection. And there is a very thin line between STIs and UTIs in men, such that you see they share the urethra, so you cannot tell which is which. So just rush to the hospital. Either way, whether you have UTI or STI, you definitely need to see a doctor for that. Now, let's go to ladies. This is where confusion usually come in, because you have two types. You have normal discharge and you have abnormal. First of all, understand that it's very normal to have a discharge in the vagina. Anything happening there, whether normal or abnormal, you must have a discharge, because this is the only way that your body knows how to clean itself. That organ will produce that discharge to clean off anything around that organ. So it's a self-cleaning organ. So that's why you get that. Now, how do you know that the discharge that you're having is just a normal process, or you're just having just an infection, or maybe another underlying condition? Now, let's get to, first of all, know what a normal one is, and then we go down to the abnormal type. Now, let's look at the normal discharge. I'm going to look at three types, and we're going to begin with the first one, which is when you're close to getting your menses and after you are done with your menses. This is just to clear the way before the blood comes out, and also after the blood is done, you'll get that discharge that will try to clear anything that was left sticking on the wall, so that you remain clean. So that's the reason. It's usually thick and whitish in color, and it might be sticky. So you might find that it's kind of sticky. You know what I mean. And also it's going to produce a very faint smell, a very faint one. Now, that's totally normal, because it's trying to clean the organ. Now, we have the second type. This is when you're close to ovulation, or when you're having that ovulation, or during sex, and also when you're pregnant. That discharge will be the same. It's going to be clear. It's going to be watery, not so much thick, so it's not going to be thick at all. And mostly it doesn't have any smell at all. It just have a scent, which is very faint. It's very hard to miss. But why would you want to? Anyway, okay. It might be stretchy sometimes, and like I said, it's not going to be very thick. It's going to be watery, kind of very not so thick. So that one is normal. Now, let's go to the third category. Now, this is when you have either brown or pinkish, or maybe bloody kind of a spot, a discharge that is of that color. Now, mostly we have several types here. We're going to look at four of them. The first one is before and after periods. This is mostly because we have some tiny amount of blood in that discharge, and this is what usually make it look that. Now, the reason why you might find it brown is because of oxidation. Now, you have red blood cells that usually have what we call heme. That heme contains iron. Now, that iron can be oxidized, and like you've seen in corrugated iron sheets, when they rust, they usually become brownish. This is the same reason. So you have that iron in that blood, and when it becomes oxidized, especially if you have an acidic vaginal canal, you're definitely going to have that being a little bit, not so much brown, but it's going to be brownish. This is also true for after getting your menses, after they are done. Now, your body is trying to clear anything that was left, so you might get that discharge having those stains. Either they're going to be red, or maybe they're going to be pinkish, or it will have that stain of a brown color. So that's one. The second one is that one which is brown. Like we said earlier, this is because of oxidation of some of them blood from your menses, and you're going to get it brown. Third one, mostly this is after sex. You might have maybe the sex was not that comfortable, maybe you went dry, so there was no enough lubrication and the friction was high. So this might create tears and some injuries that might ooze blood. Now, this one might come out in a discharge and it will be either brown, red or pink, depending on what happened. So if it is stayed a little bit longer, it might be brown because of oxidation. Number 4 is what we call spotting. Now, spotting mostly happen when you have some tiny amount of blood coming out when they're not supposed to. Now, we have several reasons for this, some of which are abnormal, others are just normal. First one is especially when you're supposed to get your menses, but you don't get them, and instead you just spot. And previously you've had unprotected sex. So this is a classic sign of being pregnant. Now, there's a reason to this, but before you get there, also in between your menses, so in between, and you start spotting and you had unprotected sex, this might be a very, very good indication that you are pregnant. Now, the reason you're spotting because of being pregnant is after fertilization, you know what usually happen? Implantation. Now, this implantation usually happen in the uterine wall. Now, this wall is what usually gets damaged when you don't get pregnant, and it usually come out as blood. Now, when that egg gets into the uterine wall, it wants to do what we call the implantation. It usually burrows inside the wall. Now, that it will dislodge some of that blood and it will come out, and this is why you're going to get spotting. And this spotting will be followed by a discharge that will clean everything. Now, remember also, a discharge, another type of a discharge which is very normal, is when you're pregnant. Now, when you become pregnant, there is a hormone that we call progesterone, which usually facilitates the continuation of your pregnancy. So it protects your body and tells everything that you're pregnant. Now, one of the things you usually do is telling your cervix to produce more mucus and place it there to create a barrier so that nothing will come and enter there because we now have someone there. So it creates a barrier. Now, that barrier is in form of a mucus plug and also a discharge. So you're going to get that because you're pregnant, and that's totally normal. In case you are spotting and you are past your menopause, so you're already in your menopause and you are spotting, you are going to look at this in the abnormal type of discharge. Now that we have seen the normal type of discharges, now let's look at the other side, the abnormal ones. I'm going to look at 7 of them, the most common ones. Now, the first one is you have a light discharge, which is not thick, but it's a lot. You're going to have a lot of it. It's not thick. You are having a fishy smell. This is because of the bacteria that you have that are producing sulfur. So this sulfur is what now you're feeling. You're getting that very foul and very strong smell. This is mostly because of bacterial vaginosis. Now, this is an infection. When you have that, the bacteria that are there are producing sulfur, and this sulfur is what usually give that bad smell, the fish smell. And if you have that, you definitely need to see a doctor. You definitely need to go and get checked and get the drugs for that. Now, let's go to the second type. Now, this one also is having a very unpleasant smell, totally very unbearable. But another characteristics is it might look yellowish or greenish. And sometimes it might be frothy. This is mostly because of a sexually transmitted infection, what we call TB. This is Trichomonas vaginalis that usually cause trichomoniasis. So in case you have this, like we said. So number 3, this is a very interesting one and very, very common. So you're going to have that thick white discharge that doesn't smell at all. So mostly you're not going to get that smell. It might not always be white, it might be creamish, but some symptoms that usually accompany this is the outer part of the female reproductive system. You might find an inflammation. So when you're passing out urine, it might become very itchy and you have that burning sensation, or during an intercourse. So that one is due to the inflammation around your labia, the external part. So there you're going to have a very, very, very nasty itch. This is because of a yeast infection, and the common one is Candida albicans causing candidiasis. So you need to see a doctor for this. We have several drugs for this. You can have a cream to apply. You can have pessaries to insert inside there, and also drugs that you can swallow. What mostly causes yeast infection has to do with your immunity. This is majorly. And in other times, when you take antibiotics for a long period of time, you kill the bacteria that is supposed to be normal flora. And when you kill that, the yeast will overgrow to occupy that empty space. That's why you get that. Or maybe when you change the pH of your vaginal canals, you're going to attract the growth of this yeast, so causing this infection. Now, number 4, this discharge is yellowish or greenish, but it comes with a pain in the lower abdomen and also pain during sex or when you're passing out your urine. Mostly, this is due to an infection by either. You might have either or. So you might have both of them or one of them. Chlamydia or gonorrhea. So you might have one of them or both of them. So they are very, very notorious when it comes to pain in the lower abdomen and also that discharge that we have described. Discharge type number 5, this one, you're going to have a very strong smell and also characteristically, you're going to have sores. You might have them or not, but mostly they are there in all the cases. Okay, 90% of the cases, you're going to have sores around or either outside your vaginal canal or inside, and you're going to have those sores and blisters. Mostly, this is due to a viral infection by HSV. This is herpes simplex virus. We have 2 types. We have HSV type 1 and HSV type 2. Type 2 mostly is genital, but you might find it around the mouth. But the one that's found mostly around the mouth is type 1. But they might interchange. But the one that is mostly associated with a genital herpes is HSV type 2. We cannot mention HSV without mentioning HPV. Now, HPV, this is our number 6, causes brown and bloody discharge, and mostly it's watery and it has a very unpleasant smell. You might bleed between your menses, also after sex when you're passing out urine, and also you're going to have a high urge of urination, so you feel like you want to go to the washroom every now and then. But you have to understand that in case you have this bloody or brown discharge, it might be because of cervical cancer or uterine cancer or just growths. You have growth that might happen either in the uterus or along the vaginal canal. So in case you have any of that, especially fibroids, they are very notorious when it comes to that discharge, which is brown and bloody. You might want to see a doctor so that they get to understand exactly what's causing that, so that in case it's something that is treatable, you get the treatment for that. But if it's something normal, you just wait and have that disappear on itself. Discharge type number 7 and the final one, this is when you have heavy, foul-smelling discharge, mostly accompanied by pain in the lower abdomen. This can be confused with, not confused because this will be part of this. Gonorrhea and chlamydia, they are the same symptoms that you're going to get here, and we are talking about pelvic inflammatory disease. This mostly happens when a bacteria move from, or maybe not actually move, they might be introduced, or maybe they move upwards or upstream from your vaginal canal into the uterus and causing that inflammation. So when you have that, you're going to have this kind of a discharge, you're going to have pain in the lower abdomen, and you definitely need to see a doctor. In case you have any type of a discharge that you have mentioned, you really need to see a doctor because we really need to treat that as early as possible before it becomes complicated and introduce other conditions. Like, for example, you have that untreated bacterial vaginosis. It graduates to PID, which is pelvic inflammatory disease. Now, this will cause inflammation, and this is going to affect even your fertility. Now, I noticed that a whopping 50% of you, they are watching my videos without subscribing. I really want you to just subscribe and hit that bell because so much is loading. We have a lot to cover. And we must be healthy. We must know why we need to treat something and why you don't need to treat other things. So be informed so that when you go to your doctor, you have the right information.